Hi, dermatologist here. Before I get started, huge trigger warning. We're about to watch an entire surgery. This creator invited me to react to the removal of this cyst, which he said he had had for 12 years. Thanks for the invite. I will tag you below. Here we go. If you don't want to see this, get out. Okay, so it looks like we're on the back of the scalp. I believe this is probably a dermatologist doing the surgery. Notice the sterile drape around the area, the sterile gloves. I'm going to guess that this area was cleaned beforehand with something like HIPAA cleanse. Like, this is why we can't do these things at home. It looks like we're making an initial incision over this cyst. The doctor does say something at some point in this video about having like drained most of the contents already. And we're giving pressure on the two sides. People have different approaches when it comes to these surgeries. Some people try to drain the cyst and then remove the lining. Other people try to remove it whole. Usually I try to remove it whole if it hasn't been ruptured. The reason for that is the more of the cyst contents that you get under the skin that might be left in there, the more inflammation might happen. You can also, with some of these, try to just make an incision over top and like try to pop them out so they just pop out of the skin. Quite often, especially if people have had these cysts for a long time, they have a lot of adhesions. They have like bands of tissue that are attaching them under the skin. And scalp is a very difficult area to work in. It bleeds a lot and it is quite often very tight. Also, when you're closing up in this area, we're not going to see the process of suturing today, but you don't want to get hair inside the wound because that could cause inflammation too. And obviously, it's surrounded by hair, so a little bit challenging. When we're doing this, we quite often use lidocaine with epinephrine in it as the anesthetic. Ugh. Oh man, I really squirted. Um, I always say if you're trying to extract something like that, I'll usually like put a gauze over the opening so that if anything flies out, it doesn't get me. Um, I have had cyst contents on my scrubs before. Typically, they do not smell good. Um, that said, it looks like it's all drained now, and now we're going to try to take out the lining. The reason we want to take out the lining of these cysts is that if you just drain them, they're going to close up and fill back up again, and the cyst is going to be there still. It might take it a while to refill and get as big, but it may be even harder to take it out the next time. So you could see here the doctors got the cyst lining with her forceps, and she's trying to move it around, wriggle it around, and typically what you could do here is like kind of stick a finger in to feel for where the adhesions are and go around and snip them. You'll see she's using another technique here called blunt dissection, which I love. This is a very non-traumatic way to spread apart the tissues. So you're taking kind of a blunt scissor, putting it under the layers while it's closed, and then spreading it open. And that helps to spread apart the different layers of tissue without cutting anything. The reason you don't want to cut stuff is you could cut blood vessels and then there's more bleeding. You could traumatize the tissue more. Here we have the assistant with a skin hook retracting, just opening the skin to give her a better view. I'm not a huge fan of skin hooks. One of my attendings when I was a resident made me do entire surgeries and suturing with just a skin hook and no forceps. And that was challenging, to say the least, but I did learn how to do it. Okay, just kind of moving that lining around. It seems like we have two forceps now. More blunt dissection. This is quite often like a really long process, arduous. I've edited it down for everybody so that we could see the full process in a few minutes. What kind of cysts can we see on the scalp? We can see epidermal inclusion cysts, which could come up at other areas of the body. So those are cysts where the cyst lining just looks like skin. And it's basically dead skin inside. On the scalp, we could also get what's called a pilar cyst. Oh, we're getting our full lining out now. Pilar cysts are derived from hair structures. So you will see components of hair structures under the microscope when you send it for pathology. My guess is that they will be sending this to a lab. Usually any surgery that you do, even if you're not concerned for something dangerous like cancer, you send it in because you never know what you're going to find. Do people have to get cysts removed if they seem benign and if they're not causing people any issues? Quite often, the patient and their doctor will make a decision together about what to do. Sometimes you could track these over time. Usually, I tell patients to have them removed if they're painful, if they're bothering them, if they're getting inflamed. But in any case, that's going to be up to the clinical reasoning of the doctor and their discussion of the risks and benefits with the patient. So, see, here we're doing more blunt dissection. Also, if you see specific bands, you can just cut with your scissor here. I'm going to guess that this surgeon is really experienced because this is really well done. It's almost all out. You can see it's hanging on by a little band there. There we go. And she's showing